Hi, this is Barbara Corona, video discussion number 4. Explain the role of genetics in healthcare and how it is impacting the world's expectation of healthcare. Well, I think genetics is going to be big leaps and bounds for us. I think in the future, a patient that has cancer will be able to intervene somehow to stop it or eliminate it. I love anything that has to do with labor delivery, prenatal, things like that. So I found a website called Your Guide to Understanding Genetic Conditions. When a genetic disorder is diagnosed in a family, family members often want to know what is the likelihood that their children will develop this condition. This can be difficult to predict in some cases because many factors influence a person's chance of developing a genetic condition. One important factor is how the condition is inherited. Well, to find that out, guess what we have to do, ladies and gentlemen? We need to do genetic testing. Test the parents. It's important to note that the chance of passing one genetic condition applies equally to each pregnancy. So if a couple has a child with an autosomal recessive disorder, the chances of having another child is 1 in 4. Having one child with the disorder does not protect future children from not inheriting the disease. So basically, just because you have a child with the disorder doesn't mean your next one won't have it. They still run the risk of inheriting this disease. Genetic professionals can help people understand these chances and help them make informed decisions about their health. I think this is a great thing. I have a friend, unfortunately, that their first child has SMA. It's called spinal muscular atrophy. He has the worst kind. There's 4 kinds. His is type 1. They have been told that by the end of this year, their child will pass away. He's about 1.5 years. And I think that's sad. I think no parent should bury their children. And I know that at the University of Utah, Reproductive and Endocrinology, they can manipulate the genes to avoid this. Of course, insurance doesn't cover these types of things. But the point is, because you have people studying genetics, they can manipulate this, and they can have a healthy baby one day. I think that's wonderful. What ethical dilemmas might we face in healthcare with the advancements of genetics? Well, ethical dilemmas. Well, the first thing we hear is, it's God's will, why interfere with it? Things like that. Then you have the quote of designer babies, where you can manipulate the genes and make the child smarter, taller, thinner, things like that. I want a boy or I want a girl. You can pick and choose and design basically your baby. Nowadays we have couples with one child with a severe genetic disease. They are thinking of having another child. The doctor tells them they recently become possible to test an unborn child for the disease. We have amniocentesis, CVS, and now the U of U has developed Maternity 21, where it is just as effective as an amniocentesis, just less invasive. You have to be 10 weeks along in the pregnancy. The mother's blood is drawn. 7 days later, they tell you the sex of the baby and its genetic makeup. It's quite wonderful. And insurance companies cover it. Our increasing ability to manipulate genes raises promises of treating and curing genetic diseases. The same tools could be used to enhance other traits such as height, weight, and intelligence. How does the media impact the public perception in treating, screening genetic disorders? Well, the media stories may omit important facts that can lead to the misconceptions among the genetic research. For instance, media reports may neglect to mention that the discovery of a major susceptibility gene is common for the diseases of breast cancer or prostate cancer to only the patients with early onset or strong family history of the disease in question. Also, mass media reports about the discovery of genes are rare diseases may inappropriately exploitate the results to common diseases or fail to highlight the time between the discovery of the disease-related gene and the development of tests or treatments for that specific disease. There are other extreme media coverage that focuses on negative aspects of genetic discoveries, may lead consumers to fear their application. For example, the media commonly reports on the dangers of inherited genetic research, such as insurance or employment discrimination, and the possibility of genetic enhancement, the designer babies. So you have your good things, your bad things. I am totally forward for genetic testing and learning to somehow beat this cancer or these genetic diseases that we might carry, so people have the opportunity to be parents of healthy children. I don't know about designer babies, but just healthy children. I hope you enjoyed it. I hope I answered the questions, and I hope everybody has a good night. Bye.